Prenatal care is important for promoting the health of both the mother and fetus during the pregnancy through the prevention of disease and early detection, diagnosis, and treatment of problems common to pregnancy. Prenatal care consists of a series of scheduled medical office visits which provide the opportunity for continuous assessment of the mother and fetus. The medical assistant is responsible for setting up for the prenatal examination, preparing the patient, and assisting the physician as needed during the exam. During each prenatal visit, the medical assistant updates the patient's prenatal record, checks on the health of the mother and fetus, lends support to the mother, provides her with ongoing prenatal education, and ensures that she is well informed and prepared during her pregnancy, childbirth, and the postpartum period. Before proceeding, sanitize your hands. Set up the tray for the prenatal examination. The equipment and supplies depend on the stage of the pregnancy and may include the measurement of the fundal height, the measurement of fetal heart tones, the examination of the legs, feet, and face for edema and the development of varicosities, and a vaginal examination. In a normal pregnancy, a vaginal examination is not performed until approximately 2 to 3 weeks from the due date. The purpose of the vaginal examination is to confirm the presenting part of the fetus and to determine if there is any cervical dilation or effacement. The patient that is being seen for this prenatal visit is 23 weeks pregnant. Therefore, a vaginal examination will not be performed. Greet the patient and introduce yourself. Identify the patient and explain the procedure. Provide the patient with a urine specimen container and ask her to obtain a urine specimen. After the patient voids, her bladder will be empty. An empty bladder makes the examination easier and is more comfortable for the patient. Escort the patient to the examining room and ask her to be seated. Seat yourself so that you are facing the patient. Ask the patient if she has experienced any problems since the last prenatal visit, and record any information in the appropriate section of her prenatal record. Measure the patient's blood pressure and chart the results in the prenatal record. Weigh the patient and chart the results in the prenatal record. Maternal weight gain or loss assists in assessing fetal development as well as the mother's nutrition and state of health. Instruct and prepare the patient for the examination. Ask the patient to remove or pull up her outer clothing to expose the abdominal area. In the last month of the pregnancy, the patient is required to remove her underwear and put on a patient gown with the opening in front for the vaginal examination. Since this patient is not yet in her last month, this step is not necessary. Inform the patient that the physician will be with her soon and leave the room to give her privacy. Test the urine specimen using a reagent strip for glucose and protein and chart the results. Urine can be tested any time before the examination. However, a convenient time is while the patient is disrobing. Make the medical record available for review by the physician. The medical office has a designated location where the record is placed. In this office, the medical record is placed in a chart holder mounted on the wall next to the examining room door. Position the medical record so that the patient identifiable information faces the wall and is not visible. Check to make sure the patient is ready to be seen by the physician. Always knock lightly before entering to let the patient know you are getting ready to enter the room. If the patient is ready, inform the physician. In this office, this is done using a color-coded flagging system mounted on the wall next to the examining room. Assist the patient into a supine position and properly drape her. Provide support and reassurance to the patient to help her relax during the examination. Assist the physician as required for the prenatal examination. Hand the physician the tape measure for the determination of the fundal height measurement. The physician measures the fundal height by placing one end of a centimeter tape measure on the superior aspect of the symphysis pubis and measuring to the top of the fundus of the uterus. During the first and second trimesters, measuring the fundal height provides a rough estimate of the duration of the pregnancy. Turn on the Doppler fetal pulse detector and hand it to the physician. Apply a liberal amount of coupling gel to the mother's abdomen for the physician to check the fetal heart tones. When the physician is finished, remove excess gel from the patient with a paper towel. Also, clean the probe head of the Doppler device with a paper towel. Place the probe head back in its holder. If the patient was in the last month of her pregnancy, at this time, you would assist the patient into the lithotomy position for the vaginal examination. After the examination, assist the patient into a sitting position. The patient may become dizzy, therefore allow her the opportunity to rest for a moment. Provide prenatal patient teaching. Further explain the physician's instructions to meet individual patient needs. Assist the patient off the examining table to prevent falls. Clean the examining room in preparation for the next patient.